My name is Velle, and I have bilateral medullary sponge kidney, and that means that I have it in two kidneys. I was diagnosed in 2003, and at that time, it seemed that I only had MSK on the one side. And at that time, I saw a specialist from the University of Calgary who said, you might have medullary sponge kidney. We can run a few tests to say definitively that yes, you have it. But, whether you have it or you don't have it doesn't change. There's no treatment, and really, you're not even going to notice that it's there. It's just, it's just sort of one of those things, and you might pass an extra kidney stone or two. And I thought, okay, I can live with that. And I just forgot about it. Didn't think about it again really for a very long time. And then, but by that time, I already was dealing with some really serious fatigue, having problems with stamina. Um, and I had this ache that I feel most of the time like I'm a patient recovering from having been hit by a truck. And that's not an exaggeration. Um, there are days when I just can't do anything. And on better days, I can get a few things done. But without medication, I'm pretty useless. Um, anyway, I was getting progressively worse, and doctors couldn't tell me why I was aching. They couldn't tell me why I was so fatigued and why I had no stamina. I homeschooled my kids, and I was working, 3 or 4 nights a week, and I had to cut back on how many nights I was working until I was only doing one show a week, and then less and less I was able to actively do things with the kids for their schooling, and more of it uh, was was of my part of it had to be done at home, and my kids missed out on a lot of stuff because I couldn't do it. Um, Later, an ultrasound found that I had medullary sponge kidney in both kidneys, and I thought, oh, okay, that's interesting. So it's on both sides. Great. So now I have two things I don't have to worry about. And but still, I was continuing to deal with this fatigue that was getting worse and the aching. And in 2012, I woke up one morning and realized I was peeing blood, and that freaked me out. Um, I'm not a fan of peeing blood, and it doesn't matter how many times I see blood in my pee. I don't like it. I'm not a fan. Um, so that's what started my investigation into MSK online. When I saw my doctor, by the time I saw him, it had cleared up, and as far as I could tell, it had cleared up. And he did a dipstick, and he said, "Oh, there's a lot of blood, a lot." And he said, if there was more, you'd be able to see it in the urine. And I said, well, I could see it before in the urine. That's why I'm here. Um, anyway, so I get online, and I was finding a lot of conflicting information, contradiction on contradiction, and even the experts um, didn't seem to agree on what medullary sponge kidney was or what the symptoms were. Some said that it involved cysts, and some said it, the idea of cysts is a mistake, and some said it's genetic, and others say it's not genetic. It was just, it's frustrating when you know something's wrong, but you can't find any definitive answers. And so, um, what I did find were other people like me who also had symptoms and medullary sponge kidney. So, uh, I set up the MSK Online Project website and set up a web form to, the intent was to have medullary sponge kidney patients feed their information, their symptoms in, so that we could compare notes and see, how many of our symptoms are likely to be because of medullary sponge kidney. Well, the very first phase, we only had 14 people participate. And 100% of those were having problems with fatigue and stamina. Um, I think it was almost 80% were reported that they had chronic pain, and um, it was near 70%, I think, reported they had insomnia. And so that was uh, that was confirmation to me that my symptoms likely had something to do with the MSK. And that was a relief. It was a relief to find people like me who could relate to what I was experiencing, and it was a relief to finally have some answers about what was making me feel like crap all the time. And so we've since done a second phase, uh, which was more detailed than phase one. And I'm still compiling the data on that. But what's very clear is that of the 76 people who participated in that, the vast majority of them also are dealing with problems with fatigue and stamina. The vast majority of them are reporting that they have chronic pain, and a good number also have insomnia. But we've discovered some other things too. But as the data is compiled, that'll become a little bit clearer. Um, Uncomfortable pause. So, anyways, long story short, we've contacted Professor Giovanni Gambaro. He is one of the world's leading researchers on medullary sponge kidney, and he has taken an interest in this group of symptomatic MSK patients. He is going to be starting some research on us soon, we believe in the next month or two, and hopefully that's going to not only bring some more answers for us, but also give us something concrete we can take to our doctors and say, see, look, I have pain. I was one of the people in this study. How cool is that? That's very cool. Anyway, if you are a medullary sponge kidney patient and you have symptoms that just aren't fitting with what the doctors say MSK is, you're not alone. There's a bunch of us that are dealing with symptoms that just don't seem to fit the profile. And if you're a doctor who's treating an MSK patient, um, he or she is not the only one complaining of the symptoms they're complaining of. There's a bunch of us. So we don't expect that there's going to be a cure for medullary sponge kidney because at this point it looks like it's a birth defect. That's the current thinking. And if it's a birth defect, well, there's just not a lot you can do about that. However, it goes a long way when we try to explain what we're experiencing. It goes a long way if people believe us. It goes a long way if people try to understand and just know that the, the struggle with this disease is very real. Um, nobody wants to live their life the way we're living our lives. It just isn't. You'd have to be nuts, frankly. You'd have to be a loon. So visit the MSK Online Project. Join our Facebook group. I'll put a link somewhere. And thanks for watching.